how I would have felt too.
Aren't you her mom?
I can explain. No, that's my sister, Lynette.
How did this woman get back there? Just say hi. Hello, I'm gonna say hi.
Is everything all right in there?
No, I want the pill! Shut up! You have done enough. Get the out of here. Hey, lady.
You're both gonna go to jail.
She is lying.
I think assaulting the doctor is not the right way to handle this. Today we're watching an episode of HBO Max's The Pitt, and it has been touted as the most accurate medical TV show ever made. And can't say I agree with that based on the obstetric emergency scene that we watched. That was embarrassing how bad it was. But we've watched a couple other episodes that were really good. So this might actually be the tiebreaker. This one has to do with some things that are very relevant to most people around the world, but especially if you live in the United States right now. Let's jump into it.
Wheeler, Kristen?
It's Christy, and I'm her mom.
Dr. Abbott went off duty at 7, but that's no problem. We'll get you back. Have a seat until we call your name.
Have you been here long?
We've been here about 4 hours.
We were here 2 nights ago. We waited 7 hours.
I always look at the ED wait list when I'm at work, and the length of time sometimes people have to wait to be seen in the ED. My gosh, it's awful. This is not only a problem in the US, it is a problem everywhere.
We were supposed to see Dr. Abbott. I guess I just got tired and I forgot to charge my phone and we overslept.
I use an old-fashioned alarm clock since med school. Never fails.
That's what I have at home. I just forgot to bring it.
Okay, I see we're doing a medication abortion today, correct?
Yep.
Well, since I didn't initially assess you, do you mind if I ask a few questions?
I'm always, when I'm on call, so paranoid that I'm going to sleep through a phone call. And I don't think I've ever actually slept through a phone call, but I'm also paranoid I'm going to accidentally put my phone on silent or something, which I think I have done one time. But if I have a really good call night where I don't get a phone call, I'm awake every hour or 2 hours just checking to see if the junior docs have called me because I'm so paranoid. It doesn't matter if I'm busy or not busy. On call, I do not sleep because I am freaking out. I don't even think an old-fashioned alarm clock could fix it.
Is this your first pregnancy?
Yes.
And you're 17? Any allergies to medication?
No.
Any surgeries in the past?
No.
I need to do another quick ultrasound to make sure everything's okay for the medication. Do you want to put on a gown to make sure you don't get gel all over your clothes?
Okay.
The reason they want to do an ultrasound is because the dates aren't for sure. And you don't always have to have that to make medication abortion safe. But with unsure dates, there is some need to make sure that you aren't really off on timing because it could make it dangerous, and to rule out ectopic pregnancy. So even though there are scenarios where we've lined out when it is safe to do a medication abortion in the absence of an ultrasound, it is not uncommon that whoever's prescribing the medication really wants to do that to make sure that it's not ectopic or further along gestation than you anticipated. So again, lots of parameters that you can go through a checklist and see if somebody fits to avoid doing a scan if you want to. But it's not uncommon that it would be something that kind of reassures everybody.
A little jelly on the belly? Sorry, it's cold.
It is a bit unlikely they'd be able to do it abdominally like that, especially if she is at a 6 to 8 week gestational age. Maybe, because she's very tiny, but a lot of times we have to do a transvaginal scan, which is a little bit more precise at being able to see smaller gestations.
Just to be sure you're not being treated for any blood clots, taking any anticoagulants?
No, I don't take any medicines.
Is everything okay?
Yeah.
She's almost certainly going to be further along gestation than anticipated. That measurement looked like 11 weeks, which you could still do, but it's getting to the cutoff though at that point. And I think last time we watched this show, this doctor had either infertility or a recent miscarriage or pregnancy loss of some kind that had upset her quite a bit. So that may be what's going on here, is that she's struggling with that.
I need a minute. Christy Wheeler, 17 years old, pregnant. These are Abbott's fetal measurements from yesterday, and these are mine.
10-5 and 11-2. Wow, ultrasound is an art, not a science.
Yeah, 10 weeks, 5 days versus 11 weeks, 2 days. That's within a margin of error. So those are both correctly measured scans that are right at 11 weeks. So you could still do medication abortion. You're getting closer to the cutoff though. This is Jack. Just say hi. Hello, Ponga, say hi. They're way more excited about Ponga than you, sorry.
Even in the very best hands, the EGA differential could be within 3 to 5 days in the first trimester. Definitely room for error.
Not if you're here for medication abortion and you're past the mandated 11-week cutoff. I didn't get a single measurement under 11 weeks.
So what are you saying, that Abbott lowballed his measurements to help a teen get the abortion that she wants?
Maybe.
Well, then you've got two choices. You can go with Abbott's measurements, or you can redo your measurements, go back in and pick an angle that shows 11 weeks or less.
Please tell me you're joking.
Yeah, so that is not a great idea. Some of those cutoffs are where things become medically less safe and people should be admitted for care. And if the laws say, in whatever state they're in, that 11 weeks and under is the absolute cutoff, that's not a safety thing, because there are ways to safely do abortion even up until middle second trimester, late second trimester, third trimester in some scenarios. But that's really, really uncommon. But you can't fudge your measurements to fit into that. And I'm a bit alarmed at the suggestion that that should be done, because it's likely they would need to admit her and have this done in the hospital. And if you don't have ability to do that because it's against the law, giving medication abortion to somebody that is going to then go home and potentially be at higher risk is dangerous. But again, it is, I don't know. I don't think we should lie about it, but I can see why people would feel like that.
Falsifying medical records for Christy is flat out illegal.
She's 17. She deserves a life.
Of course she does. But I will not jeopardize my future in the process.
You'll be fine.
Someone finds out I falsified medical records, I'll get booted from the residency program. You've got tenure. The risks are not the same for you as they are for me.
Honestly, though, I'm more bothered by the fact that someone's having to come to the ED for this. What are we doing? This is also very unrealistic. I think I forgot that we were supposed to be commenting on the reality of this situation. No ED doctors are doing measurements and prescribing medication abortions. That's silly.
You're right. I'll do it.
What?
Erase your history, physical, and impression from Christy's chart and be like you never saw the patient. I will take over. I will complete a new chart and upload my own image.
Robby, I'm not asking you to.
As you're attending, it is my decision. I am a certified provider for mifepristone. You are not.
Mifepristone is what you've probably heard be in the news a whole lot lately with regards to legality in the US. So that's what you often will hear politicians refer to as the abortion pill. In reality, mifepristone is a medication that we generally give 24 to 48 hours prior to misoprostol. And we know that combining those two medications, Miffy and Miso, both for miscarriage treatment and for elective terminations of some kind, that is the best way to help people avoid surgical intervention and the most effective method of management to not prolong the ordeal. But you can do both miscarriage management and elective termination at first trimester gestational ages with just misoprostol as well, which is up until recently not been one that they've been trying to get rid of in the US or make illegal. But now that they've succeeded with mifepristone in a lot of places, they are coming after that. And I think it's really important that everybody knows that both of these medications are also used for miscarriage care, and making them illegal, we know making abortion illegal in general is not going to decrease the rates, it's just going to decrease the safety and increase the problems that come up from unsafe terminations. But additionally, if we start making medications that we use to manage miscarriage illegal, we're also going to make miscarriage care less safe, which is equally ridiculous. So if you're in favor of these laws, you should know that you're also voting to make miscarriage care less safe for the people that you care about, and potentially for yourself.
I still don't understand why Christy needs to go through this a third time with a third doctor.
Yeah, that's our bad. Our computerized medical records have been glitching lately.
I actually kind of agree with that. I'm not sure why they scanned again. I didn't know she had just had a scan the day before. That seems unnecessary, in my opinion.
Okay, crown to rump. That's top of the head to the bottom of the butt. It's how you measure gestational age, and we are at 10 weeks and 6 days.
I made it by 1 day.
Crown rump length is what he's referring to. So if you have a fetus that's laying kind of like this, it would be a measurement from here to, I'm not going to try to move around because last time we know domino effect happened, to the bottom of the baby. And I'd have to look up what the measurements are. But after about 12 weeks, you have to start doing different measurements. But until fetus is bigger than that, you can measure a crown rump length. And it gives you a pretty accurate guess as to the gestational age. Not 100%, but within 5 days-ish.
I will order the medication. Dr. Collins will go over instructions on taking the pills when we come back from the pharmacy.
Thank you so much, Dr.
Oh,
Robby.
I'm glad I could help. Even more glad to see you have such a supportive mom.
I'm still a bit uncomfortable with this.
It's a lot to remember.
Everything is clearly labeled with the names of the meds, the dose, and the exact time to take them.
Will it hurt?
You can expect some vaginal bleeding. There may be some cramping, like when you're on your period. If you're bleeding more than 2 pads an hour, or the pain gets to be too much, come back in and see us.
Okay, this is bad counseling. Yes, that is going to be painful, especially being nearly 11 weeks. So you should be prescribing some sort of pain medication for this and not telling people it will be like period cramps. That is a lie and it is not accurate.
And I'll be with you the whole time.
Christy? Christy!
To be clear, it's not always horrible and excruciating, but it is always more than just period cramps.
What the hell are you doing
Hey,
here?
language. And I should be asking you the same thing.
Excuse me, who are you?
I'm her mom.
Aren't you her mom?
I can explain.
No, that's my sister, Lynette. I am Christy's mother.
Mom, I want this. This is my decision.
No.
Just listen to her,
You
Elle.
can shut up. You have done enough. My daughter is a minor. She can't get this abortion without my say-so.
If I was the doctor, I would be like, how did this woman get back there? And I don't know what state they're in or what the law is, but in a lot of states, minors can have abortions without asking permission from parents. This is uncomfortable, and I would not know what to do with myself if I was witnessing it.
Mom, stop! This is what you had in mind for your fun weekend with your aunt?
All right,
I was trying to help her. No, what would have been helpful is telling me that my daughter is pregnant.
So I think this is a good point to talk about the Turnaway study, which if you've watched anything I've made on this topic, you know about. But Turnaway study was a big data collection about people who were essentially turned away when seeking termination, and what the outcomes of the pregnancy and the childhood of those people who went on to have babies after seeking abortion and being told that they couldn't have it, compared to people who didn't have a reason to seek abortion. And what we see is that outcomes are universally worse in those patients who sought out an abortion and were told no than in the rest of the population, which makes sense, right? Because it's almost like they knew what was best for them and their family. But specifically, what outcomes are worse? We have worse socioeconomic outcomes for the family and the baby that ends up being born. That baby is less likely to do well in school and have a higher chance of intellectual difficulties and struggles. If there are other children in the family, the outcomes of the other children in the family are also worse. And if there are maternal complications, they're likely to be worse in the population of patients who was turned away. So it doesn't improve things to force people to carry pregnancies that they have a reason to end.
Instead, I find out from a confused teenage boy. Jackson told you? Yeah,
Whoa,
he did.
whoa, everything okay in here?
This is Mrs. Wheeler, Christy's mother. Lynette is Christy's aunt.
She doesn't want to have this baby.
This has nothing to do with you.
Okay,
No,
maybe
I
we just
called
take it.
Aunt Lynn. Okay, I don't want to be a teen mom.
It's how I would have felt too.
Is everything all right in there?
No, I want the pill.
Why don't you find a place to sit and I will...
You're gonna what? Give my daughter the abortion I've forbidden?
Hey,
What's going on? Christy's texting. Is she okay?
You can't be back here.
She's begging us for help.
Lynette, I got this. Come on.
You are treating Christy like Mom treated you.
Fuck you.
Let's take it down.
This is so uncomfortable.
Get the fuck out of here.
Fuck you. Hey, lady.
They're both gonna go to jail.
She is not.
I think assaulting the doctor is not the right way to handle this.
We are going to handle this.
This is your patient?
Yes.
No, actually, it's my patient. She's been here for hours.
Okay, that's not fair because he did hand the patient off to her for counseling on the medication. So
Patients come in already in distress, and waiting only makes it worse.
Wait time has nothing to do with
Which is why we're seeing hospital workers like Dr. Collins get assaulted,
Assaulted.
It was a little push.
which we're going to take seriously. We risk our lives coming to work here every day. What if that mother had brought a weapon?
We have metal detectors.
that's so sad and real. Do your hospitals have metal detectors?
No, that's pretty crazy.
Yeah, it turns out gun laws help with, not needing to do that. I have a friend who's there was a clinic in the same building that her clinic's in, just like across the hall. And a patient who was upset about something came in and shot a desk clerk and 2 surgeons and a nurse and killed all of them. Like, it is a real thing, and it should be taken seriously if somebody is assaulting healthcare professionals in an emergency room. That's concerning.
I've got 4 patients waiting on ICU that have been here since before I got here, and it's already 1 o'clock.
I can see that
Got
you're...
4 more waiting on psych. One of them's been here for a fucking week. So please, for the love of God, hire more nurses.
I'll come back later.
That's not gonna help anything. Same fucking thing every day. You okay?
This part of the show is very real. Like, everybody's clear frustration.
Your mom is looking for you.
If I go home with her, my life is over.
Weren't you about the same age when you got pregnant with her?
Yes, but she turned out to be the best thing that has ever happened to me.
And I hope she feels the same way when she's ready, but right now, she's not. If you push her away, she might never come back. Mifepristone.
I found that a bit unrealistic. I would imagine there's very few people who are that adamantly against an abortion who will just have one short conversation with a healthcare provider and decide, oh, okay, fine, I'll say it's okay. But importantly, this anecdote of, somebody forced me to carry a pregnancy that I thought I didn't want and it turned out fine. She's really wonderful. It's the best thing that ever happened to me is fine, real for her. But again, with what we discussed with the Turnaway study, we know that that's not representative of reality when you look at population data. So it might be fine, she might be fine, and it might not affect her life in a negative way, but we also don't know that, and we also don't know if she'll do fine in the pregnancy. Like, there are a lot of risks to being pregnant. I think we've discussed this before. Every single thing that can hurt you or kill you is more likely to hurt you or kill you while you're pregnant, and that's not to be taken lightly. Sometimes I think it gets minimized because people have babies all the time and it's fine, but it's very real. And I mean, I'm glad that she changed her tune that quickly. I don't think that would happen in reality, but it is important that people are given agency. And if you'd be able to consent to care for a pregnancy and then also to parent a child, I don't understand why you wouldn't be allowed to also make the decision to end a pregnancy if that's what you think is best for you, because we do know that in these scenarios, in hindsight, almost everybody is looked at and go, oh, you did know what was best for you. That's just how the outcomes work.
You sure you want to do this?
Yes.
Second dose in 24 hours, then misoprostol. Everything's in here if you forget.
What'd you say to her?
Something about not losing Christy forever.
Well, you gave him a chance.
That is going to be one long drive back to Tennessee.
True that.
They drove from Tennessee to get past abortion restrictions. That makes sense. She must be pregnant again after having a miscarriage prior.
No, what?
That is really sad and unfortunately a very real representation of what sometimes people in healthcare do have to deal with emotionally. And it's a very unseen difficulty. I had lots and lots of friends who were residents with me who dealt with infertility while also taking care of patients who, everybody's on their own journey and it can be really hard to separate that. I'm really proud of them for depicting this in a way where she was able to, but also allowing space for her own feelings and devastation related to her miscarriage, because we can hold space for both these things, right? Pregnancies can be beautiful and wonderful gifts, and they can also be the opposite of that, depending on life circumstances at the time. But it is really difficult when you have people who are in a situation they don't want to be in, a pregnancy they didn't intend to have and now aren't sure they can continue, and people who are also in a situation they didn't want to be in, unable to get pregnant or recurrent pregnancy loss, which is absolutely devastating. I think what's important in this discussion, and where sometimes it goes off the rails when we're having more political discussions about it, is recognizing the fact that forcing the person in this situation, like we talked about, with an unintended pregnancy they don't feel like they can continue, forcing them to carry it because you also have this juxtaposition of people who have a unwanted pregnancy that they are losing does not make any sense, right? That doesn't fix the problem for the other person. So it's important to recognize like the human part of both of these sides, I think, and to recognize that a human's response to a pregnancy has everything to do with where they are in life and what else is going on. And we can let those things coexist. That was a heavy episode, but it was fairly realistic to have someone have to drive from another state to seek care. And that interaction was intense and one I wouldn't want to have in real life. But anyway, thank you for being here today. I hope that you learned something. Sorry that was a bit of a heavy episode, but I do think it was a good discussion and a good depiction. Let me know in the comments down below if you learned anything, and I'll see you next Monday.